Now we go to the healthcare reform in Malaysia. Kita tengok apa yang berlaku dari segi healthcare sector in Malaysia. Okay. So kita tengok dari segi history dulu. We look at on the history. On 19 say kita ada what we call as IMR, Institute for Medical Research, that was established as a pathological institute. Okay. So this IMR, the objective of to develop or build this IMR is to carry out a scientific and also a research into what causes the treatment and prevention of certain diseases during that time. Yang paling sangat popular, which are beriberi and all forms of malaria fevers. Okay, that's why waktu tu ditubuhkan IMR, Institute for Medical Research. And as we know that, okay, kita 1957 we gain independent. And waktu ni kita dah start kita punya our Ministry of Health to replace the Medical Service Department. Waktu tu is under the British colony. It's known as MSD. And when we gain our independence, then it changed to the Ministry of Health. And then further development of the rural health services, which started in 1959. They have a 3-tier system. In 1969, they have start training of Bidan Kampung by National Family Planning Board. And from 1973, we have started to into our first reformation on the health sector from the 3-tier to a 2-tier system. Okay, so we know that the busiest hospital in Malaysia is a General Hospital, GH in Kuala Lumpur, and this GH Kuala Lumpur General Hospital is the government tertiary referral hospital, and it was the biggest in Asia, where actually it started in 1870s, where this is known as a district hospital. Dia ada 3 ward wooden saja and a single story. So in 1920, okay, after the First World War, it's upgraded from 3 wards to 24 wards. And after that, from this district hospital, it becomes the General Hospital for Malaysia in 1962. And if you can see, okay, now this is GH is the largest hospital under the Ministry of Health, with 100 wards and 3,000 beds. And also this is in 2013. Sekarang ni lebih banyak lagi wards yang telah dibuka dan juga 1,000 beds in the General Hospital. Okay. Sorry. Okay. So kalau zaman dulu when we talk about Vision 20, we thought that it's like okay, our Vision 2020, mungkin dalam dulu kita lamanya 2020, actually by next year kita dah 2020, and this is the vision of 2020. And for the vision for health, this is the vision for health in Malaysia is to be a nation of healthy individuals, families and communities through a health system that is equitable, affordable, efficient, technologically appropriate, environmentally adaptable and consumer friendly, with emphasis on quality, innovation, health promotion and respect for human dignity, and which promotes individual responsibility and community participation towards an enhanced quality of life. So this is the vision of health in Malaysia. So kalau goal of the vision for health, satunya of course they want to focus on wellness, focus on the person, informed person, self-help, care provided at home or near to home, seamless care, and it must be tailored services, must be effective, efficient, affordable and affordable services. So, what have we done right in our health system in Malaysia? Okay, we look at by one. Okay, what we have done right. Okay. Dekat dalam Malaysia ni, dari segi our health system, we are priority on primary healthcare. We have a health services, we have the health infrastructure, and we have a block funding by the government. Kita ada funding by the government, and our tax-based funding seems independent, which is good. And our government plays a major role in our healthcare system. And of course, the Ministry of Health is the main agency that given almost all responsibility in our healthcare system, and development of local specialist training. And also what we have done right is we have a support in terms of to local universities. Okay. Jadi kita nampak banyak perubahan our modernization of health system. Kalau dari dulu orang kata kita tidak ada a proper in terms of berpantang. Kita dulu adalah banyak bergantung kepada bidan kampung dan sebagainya. And now we can see that in terms of the improvement of our healthcare system daripada orang kata traditional untuk kepada modernization of our health system. Okay. That's the good part. That is that what have done a right thing to our healthcare system. But we want to look at what is the wrong in our health system and the Malaysian health system. Okay, our Malaysian health system, our current health system, we have the governance. Okay, the health infrastructure. We have in terms of the financings. We also look at in terms of R&D, and also we look at in terms of HHR. Okay, kita akan tengok one by one on how these orang kata 5 elements give impact to our Malaysian health system. Okay. So before we go through one by one, we look at kat Malaysia ni we have a MOH, okay, the Ministry of Health, which is MOH is our main provider for our healthcare services, and this MOH is very responsible for almost all the health policy matters, and also they have a main regulator of the healthcare services and very dominant in our Malaysian healthcare system. So Ministry of Health ni apa yang problem ni is we have a multiple role. We have a lot of role in our Ministry of Health. Our role as a policy maker, as a R&D, education and training provider, and regulator, funder, and all this is under the government. So the governments they have too much power, too much diverse role. We will call as a jack of all trade and a master of none. And the problem in the sector, selalunya sector, it's not just a Ministry of Health. Any sectors, the worst problem atau problem yang paling banyak is a work in silos. Where it's a very poor coordination with other ministries. They only look at on the orang kata kalau Ministry of Health, they are just only Ministry of Health. Sedangkan it's very important also we look at the other ministries that are very related to the health system. Carry out actions with no expertise, and like for example recent in terms of vape issue, e-cigarette issues. Kita pun but we can see now policy yang paling orang kata the latest is about the smoking in the public in the restaurants where they kind of fine and etc. Also this is part of the actions taken by the government. And reactive response and firefighting rather than proactive, precisely about the dengue epidemic. In terms of the health infrastructure, we have a very poor planning in terms of the development of health infrastructure, and we build a hospital based on political and also based on the commercial need rather than the health needs. That's the another also big issues, and this will affect in terms of the distribution of hospital services and also a poor planned health facilities. Okay, dalam dulu kalau kita ada klinik satu Malaysia, actually this is the klinik satu Malaysia is actually a poor plan health facilities. Okay. So in 2014 auditor telah menjalankan audit terhadap orang kata di bawah a few hospital in Batu Pahat and Kota Baru, they found that there is a delays for upgraded hospital due to the mention of finance choice of novice firms and audit fines. So there's a lot actually orang kata problem in terms of the management, in terms of the facility in the hospital. Okay, and also kalau dari segi keselamatan hospital, we can see that there's a lot of reported banyak sangat masalah. For example, hospital Sedang, it's actually quite new hospital ceiling collapse. Okay, and 1.5 million medicine equipment stolen from public hospital. Banyak Ipoh hospital ceiling collapse. Lepas tu ada hospital pula kena under fungus attack. This is all the problems in terms of the facilities of hospital in Malaysia. And this also recently happened the past 2-3 years ago. It's a fire at a hospital Sultanah Aminah in Johor Bahru, where this hospital is a very old hospital, and terms dari segi orang kata masalah dari segi wiring kat satu, and it affects also the people actually they want to go to hospital to get the best services, and orang kata untuk menyelamatkan diri, tapi the building itself cause people to have orang kata risk to be there because of the facilities that they have in the hospital. And then of course clinics in Malaysia dulu also have a lot of issues, a lot of problems. For example, there are also news that the sicker claims that one Malaysia clinic dispenses expired medicine. And there's a lot of issues in clinics in Malaysia. This is all the problem that we have last time in terms of our healthcare system. And kalau kita tanya kat mana kita dapat sumber kat mana hospital tu, actually kat mana kita dapat sumber kewangan funding for our health actually public is about 52% and private is about 48%. So mostly daripada 50% of the source of funding for health is come from public. It comes from taxation, whether it's a direct taxation ataupun indirect taxation, which is the indirect taxation ni including GST lah, that was introduced last time in 2015. Dari segi private pula also almost 50%, which is it comes from the out of pocket money, out of pocket payment when you do from the private insurance and also other private. So these are all the fundings for the health, but we can see that that's why public are demanding in terms of good services, because most of the 50% of the demanding comes from our taxation. So here we can see the total health expenditure Malaysia. Okay, semakin lama semakin meningkat. 1997 2010 there is increase in terms of the total health expenditure and it's a 44 million in 2013, and of course recently in 2019 it keeps increasing in terms of the health expenditure in Malaysia. Kebanyakan kita punya bajet Malaysia memang banyak kita berikan kepada orang kata isu kesihatan. And in terms of out of pocket expenditure on health as percentage of total health expenditure, we can see here in Malaysia also is quite high juga, about 42% of our pocket money is more on expenditure on health compared to Myanmar is also 81%. Sebab apa? Sebab kat Malaysia ni kita banyak subsidi yang telah diberikan oleh kerajaan Malaysia pada waktu tersebut lah. This is data was in 2011. Okay, so apa yang kita nak reforms in terms of the health financing system of Malaysia? Okay, this is I don't know lah. This is issue dalam long waiting times in public facilities. Okay, and another issue is shortage of drugs in public faculties. Okay, brain drain of specialists to private sector. Too much wastages in health spending, drugs, etc. Lack of quality efficient monitoring mechanism, and actually our health financing system we have 5 attempts to reform since 1985.